Hi, I'm Dana Hoff here at the Skincare Center at Gulf Coast Plastic Surgery. I am with Kaleigh Gordon, our nurse practitioner who specializes in hormone replacement therapy. Kaleigh, we're so excited that you're here.
I'm so excited to be here.
I just have a few questions. So, every Friday, I talk about things that impact perimenopause,
hmm
and you are our resident perimenopausal expert and are going to be treating people with hormone replacement therapy, among other things. And I just wanted to talk you through an appointment.
Okay.
So, if I am recommending my friends, what is something you want them to know ahead of coming here?
So, the first steps to getting in to see me is to call the skincare center and make your appointment. When you are making your appointment, they are going to fill out a form with the option to do cash pay or insurance, depending on what you want to do, to go to one of the local laboratories and have labs drawn. Those labs do need to be completed about 2 weeks prior to your appointment date. So, y'all will decide what date works best for you. 2 weeks prior to that, go get fasting labs done, and then you'll come in and sit down to see me.
Okay, awesome. So tell me some of the things you're looking for on the labs.
So the labs are kind of a basic panel of a CBC, iron levels, your thyroid hormone. We want to look at the big picture and see what's going on as far as like vitamin D, B12. And then, of course, we are going to look at estrogen levels and testosterone levels. The estrogen and testosterone hormones also work more off of symptoms as much as your levels to go. So if your levels look normal, if you get your report ahead of time, don't panic. We'll still talk through symptoms and find a thing that works for you.
Okay, so let's say some of my numbers are off, like estrogen or progesterone or testosterone. What are some of the treatment options that you have for people who want to level out their hormones?
So there are a lot of different treatment options, which is great because every person is so unique and they want things that fit their lifestyle. We have pills, we have patches, we have creams if you want to go something that's more like a daily or every few days type of treatment. If you want to do something a little bit more invasive that's kind of like a set it and forget it type of route, you can always do pellets. That's going to be your estrogen and your testosterone. And even if you do pellets, if you have a uterus, we will still have to do progesterone in some form or fashion. But the pellets are nice because, like I said, it's a set it and forget it method.
Okay, and let me get this straight. The reason you're doing labs ahead of time is to help speed up getting treatment, right?
Absolutely. It is to bring you in and me have a broad picture of what else is going on. Because, yes, you may have hot flashes, mood swings, all of the things that scream hormones. And that is certainly something that we are going to be paying a lot of attention to and addressing. However, if those other things that I mentioned are also out of range, if we work to improve those things too, then overall you'll just be feeling a lot better and get a lot better success much faster than if we were just treating hormone levels.
Okay, awesome. So I know I see a lot of you in the comments section on various Facebook groups looking for a hormone replacement therapy center and professional. And this is it. Kaleigh Gordon at the Skincare Center. Call us today and make your first appointment.